Dr. Flannigan. I'm a urologist at the Vancouver General Hospital, associated with University of British Columbia. I'm also the clinical lead for the Prostate Cancer Supportive Care Program, Sexual Rehabilitation Clinic. This video's purpose is to discuss managing sexual dysfunction following prostate cancer treatment, an overview. We know that prostate cancer may result in multiple forms of sexual dysfunction that impact both the cancer survivor as well as their partner. These may include erectile dysfunction, orgasmic and ejaculatory dysfunction, leakage of urine during sexual activity, changes to sexual desire, and changes in one's relationship with respect to intimacy. Studies have evaluated the predictors of sexual and relationship satisfaction amongst prostate cancer survivors. One of the key factors that they identify is the quality of communication with their partner. Another key factor is the patient-perceived partner support and the patient and partner's physical and mental health status. So if they're healthy, they're in a good space, they're communicating well, and they feel mutually supportive, then that typically leads to patient and partner satisfaction in the sexual sense. Another key factor is engaging in treatment early on and staying sexually active throughout the early process and throughout time thereafter. Communication is among the most predictive factors of sexual satisfaction following treatment. Communicate what is working and what is not working. Thoughts, worries, and ideas of how to maintain sexual intimacy are all important things to be able to communicate with your partner. But how do you do this? How do you communicate on topics of sexual intimacy? For some couples, that's going to be very natural, and for others, it's going to be very new and somewhat challenging. So you can always have a verbal conversation. If that's something within the repertoire of your relationship, written communication is something that some couples find helpful. Another easy way to break the ice is during a clinic appointment with a sexual health clinician. So if you're coming to see one of the clinicians, part of our program, having your partner there and having that open dialogue of communication, maybe initially to the sexual health clinician, and that opens up and breaks the ice to have that communication with your partner as well. And if this is not helpful, attending a dedicated and specifically trained sexual therapist appointment may also be helpful. It's also important to understand the process of sexual adaptation. We know that following prostate cancer treatment, you may experience changes to your sexual function, and it's important to embody some of the following virtues to optimize the process. One, acceptance that there are some changes and that the function following treatment may not be exactly what you'd remembered it prior to treatment. Having the flexibility to be open-minded and trying different forms of therapies, aids, ways of being intimate are really important in discovering how to optimize your sexual intimacy moving forward and really engage in sexual satisfaction. Having the patience if something's not working initially. Oftentimes, from a medical sense, we work from the least invasive forms of treatment to the most. For some individuals, the least invasive form of treatment may be very effective, but for many individuals, it won't be, and it might be the second, third, or fourth method of treatment that we use before we start getting some satisfying results. And persistence is the last one. This relates off the previous one of patience, that it often requires multiple forms of treatment to arrive at a space that we're happy with and we're getting good satisfaction with. So having the persistence to continue pursuing, coming back to the clinic appointments until we find a good solution is very important. Throughout this whole process, it's very normal to have feelings of grieving and loss as you experience some of these changes. It's important to be able to move forward with new ways of being sexual, trialing therapies available, and to a certain extent redefining your sexual self-view. One of the ways that's really important in engaging from an early standpoint is the concept of penile rehabilitation and sexual rehabilitation. This is the concept that early treatment to encourage penile blood flow and erections protects the health of the penile tissue that may result in better erectile function recovery down the road. So what's involved in this process? Well, it may be using oral medications and pills such as PDE5 inhibitors like Viagra or Cialis, penile injection therapy, or vacuum therapy, and engaging with this as early in the post-treatment process as possible. Some of the studies out there suggest that penile rehabilitation improves erectile function recovery by nearly 3 times compared to those not engaging from an early standpoint in some of these different modalities of erectile function treatment. The first line agents that we often start with for those individuals not obtaining good strong erections following surgery are oral therapies or pills. PDE5 inhibitors is what we refer to as the class of these pills. This may include Viagra, Cialis, Levitra, and Staxin. These medications can be very effective for some and do require some degree of pelvic nerve intactness to send the signal to the penis. These pills may be taken on an as-needed basis when you want to achieve an erection, or may be taken on a daily basis. Another option beyond these are intraurethral suppositories or Muse therapy. This is a little tablet that can be inserted into the P channel or the urethra, which is absorbed by the mucosa and stimulates locally an erection by getting the smooth muscle within the penis to relax, increase blood flow into the penis, and trapping of that blood to result in an erection. Penile injections are a very popular form of treatment in our clinic. They can be very effective for individuals, and one of the best parts of the penile injections is that you don't need intact cavernosal nerves to induce an erection. Here the medication works locally within the smooth muscle of the penis. It causes the arterial blood flow to increase into the penis and the smooth muscle to relax and trap that blood, resulting in an erection. Typically it works within 5 to 10 minutes of doing the injection, and ideally lasts for 30 to 60 minutes once we find the appropriate dose for you. We typically perform teaching on patients and have their partners join if they're interested, to ensure that they feel confident in the clinic setting before going home with the injections and performing it on their own. Vacuum therapy is another effective type of non-medical therapy. Here the penile shaft is placed within the cylinder, negative pressure is applied in the cylinder, and blood is drawn into the shaft of the penis. If you want to use the erection, tension band will then be placed on the base of the penis that traps the blood in, resulting in a rigid erection in the penile shaft. And finally, if these medical and conservative options have not been effective, penile implant surgery can be a very effective tool for some individuals. Typically the satisfaction rates are very high and it requires approximately 1 hour surgery to place the device, and a recovery period of approximately 4 weeks following the surgery before individuals can start using it. If we switch gears here a little bit to focus now on management of altered orgasmic function, well, the treatment of the inability to achieve an orgasm or reduce pleasure has been very challenging. Underlying causes can be treated directly. So if an individual has low testosterone, sometimes that can be treated. Again, it would have to be discussed with your physician to determine the state of your prostate cancer treatment, specifically with testosterone therapy. High prolactin levels can be treated if that's the underlying cause, or if you're using an SSRI type of antidepressant, this is often impacting orgasmic function in approximately 70% of men presenting with these problems. Some studies have looked at off-label use of medication called cabergoline, which has been studied and demonstrates improvement in up to 66% of individuals using this with an inability or prolonged time required for orgasm. Others have also reported improvement with common erection pills such as Levitra. There's also been mindfulness-based techniques that are currently being studied. If we look at management of urinary leakage during climax or sexual activity, we usually recommend starting with more conservative measures such as emptying your bladder prior to sexual activity. You may also want to think about the environment that you're engaging in sexual activity. Could you put a towel down to capture some of the fluid that's leaking? Would that reduce your stress and anxiety levels? Or if it's quite significant and you feel comfortable, would it be easier to perform in a setting such as a shower or a bathtub, where it's much easier to clean any urine leakage afterwards? Pelvic floor physiotherapy can be used to strengthen the pelvic floor muscles and the urinary sphincter, and the addition of biofeedback can also be helpful for the pelvic floor physiotherapist in some circumstances to help you guide the strengthening of these muscles. There can also be devices used to help reduce the leakage of urine. There's multiple devices available on the market. However, there has been one that was recently studied called the Eurostop device. And what they found here, if I draw your attention to the table, if we look at the pre-treatment rates of leakage, we see that approximately 12% had a large amount of leakage, 72% had a moderate amount of leakage, and 16% of individuals had a small amount of leakage. After placement of the device, 0% had large leakage anymore. 26% had moderate leakage, 28% had small leakage, and nearly half, 46%, had no leakage at all. So there's a significant improvement in the amount of urine leaked during sexual activity. Now, if we look at the impact on how the patient and the partner felt, as we can see, the patient distress changed from 14% prior to this treatment down to 2%. Interestingly, the partner distress was even higher prior to treatment at 61%, and this decreased all the way down to 11% following treatment. Essentially, this device is a rubber band that constricts the base of the penis, that collapses the urethra, and basically prevents urine from passing that point. Now, if all of these conservative measures and devices are not successful, and the leakage of urine is very distressing or even more generalized, sometimes surgery is necessary in these circumstances. There are multiple ways of treating urinary leakage. It may include a male urethral sling or an artificial urinary sphincter, and this discussion of what is best for you will be had between the reconstructive urologist and you, and really identifying what are the key points and making a decision on what would be the best method of treatment moving forward. So in summary, with respect to managing sexual dysfunction after prostate cancer treatment, keep communication open with your partner. This is a really critical factor that time and time again has been shown to be very important in predicting overall satisfaction with sexual function. Stay sexually active even early on following treatment, and continue to use different therapies as required to continue to try to optimize and improve your sexual function, and stay involved in this process. Feel free to engage in the Prostate Cancer Supportive Care Program, Sexual Rehabilitation Clinic, and all the associated therapies that we have to offer when needed from an early basis. Our program is here to help you through these changes and provide supportive medical and surgical care when required. Just want to take this opportunity to thank all of our supporters for the Prostate Cancer Supportive Care Program. The Specialist Services Committee provided funding to help us initiate this program in January of 2013, and more recently the Ministry of Health has provided funding in 2017 that allowed for the provincial expansion of our program to reach more British Columbians with sexual dysfunction and survivorship issues following prostate cancer. I would also like to acknowledge all of the other agencies that have supported our program throughout the years, as well as the individuals and families that have provided generous philanthropic support. If you'd like to look more into our program or connect with us, here are our contact details, including our email, website, Twitter, and Facebook programs. Thank you.